Namaste everyone. My name is Moumita and welcome to another important session on depression and mental health. Yes, I have brought in the topic of depression and mental health again because this is a very important and serious topic which needs to be discussed on a continuous basis until we get a solution to it. I hope you all are keeping well physically and also mentally. For discussing about depression, we have a very renowned and distinguished guest amongst us today, Dr. Mrinal K Debnath, who is a renowned psychiatrist. He is a researcher of ancient history. He is an orator, writer, script writer, and a degree holder from various prestigious universities like Calcutta University, University of London, University of Vienna, and University of Liverpool. So let's welcome Sir on board to discuss in detail on depression and mental health. So welcome on board. Today's topic is on mental health and depression. So welcome to you. And I've given a small introduction about you in the beginning. And we would also like to know from you also. Please share some memories or story which none of us know about you.
What do you want to know, actually?
Anything related which is very memorable to you, like how did you start your career or something related to your youth or childhood?
Well, that is a long story, but to cut it short, I'm a refugee from Bangladesh. This was East Pakistan at one point of time. And then with hardship, I excelled in school final exam, went to medical college, National Medical College, Calcutta University, became a doctor, and I had a lucrative private practice in Calcutta now, in Baguyati. And then I left in order to do some postgraduate studies abroad, past West Indies, British Guyana, then West Indies, then London, then Vienna, Liverpool, back to West Indies.
Okay.
There I managed a hospital, 450-bed hospital, and then took voluntary retirement, came back to my mother country. And in fact, I'm settled in a village. This is, of course, your village too. And that is where I'm living. That's all. And thank you for inviting me in the program.
Thank you so much. Thank you so much, sir, for joining me today. I'm overwhelmed and very thankful to you for joining me today. So, sir, as the topic for today is on depression
before we proceed, can I ask you, can I request you something?
Sure.
Do not call me sir.
Okay.
That is a British culture. Though I was in London, you can call me uncle. You can call me uncle.
Sure. I anyhow call you uncle from the beginning itself, but
yes.
As
no, like for the viewer, I'm telling you, I do not like sir. It is
okay.
We are no more under British.
Okay, sure, uncle. So the thing is, as the topic for today is on depression and mental health, so let us start with the basic question: what is depression, and how many types? Is there different types of depression, and if yes, then what are they?
Okay. Now, actually, if you look at mental illness, you can categorize them in two groups. One is psychotic illness, another is neurotic illness. Depression falls in the category of neurotic illness. It is not psychotic illness. Though there is a term as psychotic depression, but that is a misnomer, and I think it should be only neurotic category. There are many neurotic mental illness. Depression is one of them. And you will be surprised to know there's a huge number or huge percentage of world population actually suffer from acute depression. At one point of time, when I was doing psychiatry, it was 17%. I exactly do not know whether it has increased. Definitely it has increased because the reason for depression is increasing day by day. Now, if you consider that, let us talk about 20% of the people suffer from depression. That is a huge number of people. And depression, it is actually a state of mind. It is a state of mind whereby you feel, it is a feeling, you feel very low, sad. There are many symptoms which start slowly. Initially, we do not recognize, but when it increases, then you can recognize what is depression. It can lead you up to the state of suicide. It is happening all over the world. Now, I will go into the symptoms a little later, but let me tell you there are three types of depression. One is, we call it endogenous. Means you don't need any external cause to precipitate that. It is physiologically something happens that you become depressed. So you have nothing to do. And another one is external, or things that happens around us. That is the precipitating cause, or reactive depression. You react to certain events. You lose your very dear ones, you lose your business, you lose your huge income. A lot of things can happen in human life. And that, as a result of that, you become depressed. That is reactive depression. And it is, as I said, that because of these certain things happen to you and you are reacting, your nervous system is reacting, that is why, and it is totally curable. Endogenous depression, which is physiologically because of what you are, how your physiological system is made up with, that is not difficult, not incurable, but it needs long continued treatment. There is another type of depression which is, we call it mask depression. Mask depression means, mask, M-A-S-K. A depression you don't know, you even don't know that you are depressed. You don't feel that type, but you are depressed. That category you can say psychosomatic depression, but psychosomatic condition. And that is not something that we can go into today. One type of depression we can talk about, that is endogenous. That is, today we can talk about that. Reactive depression, as I said, it depends on different issues that comes to you. Basically, I will go into a short of physiological cause. The root cause, the precipitating factor, the condition, the symptoms comes as a result of some neurological changes. That happens in all three types of depression. That one I will tell you, and then you will understand what happens in depression. There is something called serotonin. It is a neurotransmitter. It is usually secreted in the body, in the nervous system. This neurotransmitter, the message from one neuron to another neuron, goes through serotonin. The chemical name is 5-hydroxytryptamine. Now, due to any reason, either endogenous or exogenous or reactive, if this level of serotonin or 5-hydroxytryptamine goes down, you feel certain symptoms that you can understand, feel. Like what? Prolonged sadness most of the day. In a day we have 24 hours, you sleep, you eat, and so on. Forget about that part. But the other time you feel very sad and low feeling. That is one of the things, and that happens almost every day. And that happens for quite a long time. The next thing is, we call it anhedonia, means though you are otherwise strong, nothing wrong physically, but you feel like lethargic, weak, do not, as if I cannot do anything. There is no urge of doing anything. When people get sick physically, they cannot do anything. But you are not sick, but you don't feel like doing anything. So that is known as anhedonia. Hedon means body. Body don't work, not working. Then another one is a pessimistic view of life. I don't see any future. My future is bleak. I cannot do anything. I cannot change anything. I am a failure. This type of thought. So remember, everything is in your thought process. Everything is in your thought process. Then comes some physiological symptoms. First is mental conditions, mental state. That comes physiological. Like what? Disturbed sleep. You cannot sleep properly. Means you can go up to sleep, no problem. But you wake up very early morning, 1 o'clock, 2 o'clock. After that, you cannot sleep. That is one pattern. And that is, in most of the cases, this is what happens in depression. People do take sleeping pills because it is very hard to wake up every morning at 1 o'clock, 2 o'clock when everybody is sleeping. And then the morning hours are very bad because you have not slept. Very bad for you. Depressed patients don't feel good. They don't feel like doing anything. Then as the sun rises, days goes by, you feel a little strong and things like that. So that is this sleep problem. Slowly, when this depression is not treated, then you lose appetite, start losing appetite. You don't feel like eating at all. As a result of that, what will happen if you are not getting a food supplement, if you are not eating properly, definitely you will be weak. You will be anemic as it goes. At the same time, the psychological things also become worse. As I told you, I'm a failure. I don't have any future. What for I should live? Slowly, a depressive thought will lead to suicidal thought. That is only in thought stage. If it is still not treated, then comes the suicidal planning. I have to die. It is worthless for me to live. I have no meaning. Why should I die? What for? Why should I live? What for I live? I have nothing. So I will kill myself. How? That plan goes on for some time. Means it is not that anybody can commit, anybody can take a rope and hang himself. But whether I should do or I should not do, this thought process goes on for some time. And when the person cannot tolerate anymore, the torment, the mental torment, the condition, the feeling, he cannot take anymore. He actually commits suicide. So depression is a very severe type of mental illness. If not treated, it leads up to suicide. So These are mainly the symptoms. I told you psychological symptoms, told you the physical symptoms. And if you are suffering from depression, not eating properly, your nourishment, your body goes down. So it is a very, very serious and severe condition. It happens in all type of depression that I mentioned, three types of depression. Endogenous, you need treatment. Now it is a chemical reaction, means your serotonin up. So you should take chemicals. A lot of people goes to counseling, this, that, and so on. But you do not want to do anything since morning. And if I go on and talk to you for a whole day, will it register in your brain? No. So you psychiatrist.
Yeah, and as per the third type of depression, as you say, the patient himself or herself doesn't know that he is suffering from depression. Then
Yes.
how will the people around them can help them, because they themselves don't know that they are suffering? So what symptoms can help them realize that, okay, this person is behaving in a different way, or he has some
The
problem?
third, I understand. The third type of depression that I told you, mask depression, which is
Mask
called
depression.
mask, M-A-S-K, mask
Yeah,
that you don't see. It is a mask
mask.
around you.
Yeah.
You are walking around, you are doing your daily chores, you are working, you are cooking, you are going out, everything you are doing. But always a subtle, sad feeling you have that do not at all. And different physical symptoms start coming. As I told you, anything, any mental reaction that goes inside, it comes out in the form of physical illness. Pain here, pain there, chest pain. Obviously, headache is one of the main thing. Cannot sleep. If you are not sleeping properly, if you are sleeping only 3 hours or 4 hours night, then it has effect on you. That is known as sleep deprivation, and it causes slowly after a while you become physically ill. And this illness, people do not understand that I am basically depressed. And in my practice, every day a patient comes, they do not know that they are actually depressed. I don't tell them. Because if I tell that you are suffering from mental illness, they will not come to me. But I treat, I give them antidepressants and they feel good. So, doctor, you gave me a very nice painkiller because I don't have any more pain. Assistant usually laugh and say, uncle, which one is the painkiller? I said, there is nothing. I didn't give any painkiller. But the patient got better because I treated her depression. And as the depression has gone, she or he is feeling good. It usually happens to the ladies, don't mind why, because I don't know what the viewer will say, but in our society still, the ladies are always at the receiving end. They have to take care of the family, they have to take care of the husband, they have to take care, even husband is in problem, if there is any financial trouble, it is she who think most. Because at the end of the day, she may not eat, but she will make sure that her husband or her children or family members are eating. And if not, they will not feel good. So it is the ladies who usually comes to me with all these psychosomatic symptoms. But the root cause is depression. That is, as you asked, root cause is depression. A lot of people do not know. A lot of people do not know. And we must recognize that. Maybe some other day we'll talk about psychosomatic condition. There are many.
Right, right. So, coming to that, just I will also cover a small part of it. Talking about the woman, I was going through an article the other day, and that also mentioned the same thing, that majority of the women suffer from depression, like as compared to men and women, the ratio of women suffering from depression is higher than that of men. So I think there are some other problems as well. We will come to that on the next session if we get a chance to do another session on the same. So the thing is, coming to mental health and depression again. People often are taking it as a taboo. Till now, I guess in India, most of the people are not able to accept it in an open way. And people still think whenever we talk about mental health, they feel that, okay, maybe they're talking about the person going crazy or mad. They can't accept it as any other illness of a human being. That's what I'm saying. Why are people not able to accept it in a proper way? And why are people feeling so shy to talk about it? Even if a person who is suffering from depression uh, knows that, okay, I am suffering from depression, I know these the symptoms which are told to me by the doctor or someone who has a little idea about depression, is telling me, okay, these are your symptoms and I guess you're suffering from depression, but still that person doesn't want to open up in front of others and doesn't want to talk about it. So what should that person do, and why are not they able to speak about it?
Let me tell you the basic thing. In our country, we worship Mother Goddess, so many goddesses and all these things we have. But in fact, we treat the woman the most horrible way than any other country. The reason is, well, maybe some of you may not like my term horrible way, because the women are not economically independent. A lot of women, a lot of young ladies, they are now coming up, they are going to universities, they are going to different professions. They are not, they are independent. But what percentage of the ladies? A very small percentage, isn't it? So you do not have the economic strength, economic independence. You are bound to submit yourself at the whims or willingness of the men. And we do not treat them as Mother Saraswati or Mother Durga or Mother Kali. That is the basic fact. A lot of people will tell me that I am biased, but this is how I feel. The economic dependence make the women in our country more vulnerable to depression. They have nothing to do. They cannot do anything. They cannot do anything. And they are exploited by different way. And that is why that exploitation again brings depression. And let me tell you, the women are more sensitive than the men by nature. So every little thing that happens in their family, it affects the ladies. But the men, oh, we'll see it later on. That's all. We can go off like that, but the women cannot. Because women are by nature their mother. They have their children, they have their husband, they have their, even nowadays, the young ladies take care of their parents more than the young boys. That is a fact. Every day I can see that. So it is not the country, it is the way of thinking that we all are equal and somebody is taking care of home and somebody is earning money. But we have not learned to treat the woman the same path as we are. That is a fact. Anybody can dispute with me, but that is a basic fact. And that is why we in our country, the women, they suffer from depression more than any other place. The other place, women are liberated. They have their economical independence. So they can do anything. But that has other flip side too, but that is a different ball game altogether. The main cause is that not our country it is a system. That is how it is going on, but things are changing. Things are changing for good, things are changing for bad too.
You have been to different countries all throughout your life, like starting from,
Yes.
yeah. So you have been in different parts of the world. So what do you feel like? We are talking about depression today. So
Yes.
what do you feel? How should we move forward and help our countrymen in understanding it in a better way? How can we help them?
We still have every 42 minutes one woman get raped. Every 90 minutes still in our country, every 90 minutes one woman is burned to death or dowry. That's a fact, whether you want to believe it or not. But this thing don't happen in other countries. I have traveled many, many places. I have never heard about this dowry system. I have never heard that so many people, if you open the newspaper, it is rape, gang rape, before it was rape and now it is gang rape. Who are doing it? Who is the men? No. Now, these things, I'm not saying these don't happen in other countries, but I think in a way we are still in a shell, in a lot of way. We, in the name of protecting our women, we torture them. What is the rate of domestic violence in India? Just go and do research. How many people take drink in the evening and come and beat up their wife, or they abuse their verbally their girl children? Take the instance. This is happening. Other country, other places, the women don't tolerate these things because they are economically liberated. They have a free choice. They can stay with the companionship or relationship, or they can leave. Whether you can, we talk, oh, this is bad, this is that, and so on. But at least they are treated humanly. And because of that, that is necessary. That is necessary. And because we do not implement that, women are more vulnerable to depression that is happening.
So as you are continuing to treat your patients, what do you think? Is depression becoming more common these days, or it has continued in the, like, it is going on the same same graph only, or is it increasing?
You see, the thing is, that day I was looking at one of your video that you have shared, interview. I'm simply surprised to see that they're giggling and they're not sorry that they even do not know the date or the year of independence of India. They're not
Actually,
not ladies I'm talking about the boys too. And they,
exactly.
that the whose day we got independence, whose year we got independence. There are so many other questions and I was thus spellbound. When I was in their age, I knew all these things. It is not that I now know, but they are actually losing one side of life. That is known as knowledge.
Hmm.
Huh? University, you go to university, get a degree, that is not giving you knowledge. And if you have no knowledge, if you are lacking knowledge, no matter how much technically savvy you are, your life is not going to be happy. You will be depressed at one point of time. And that is
Absolutely.
these ladies and young men and women that you showed that day. Huh? And I made a comment about that too.
Yeah.
They are suffering from depression because they are choosing a lifestyle which is not good for them. And as it is, though it is individualistic lifestyle, but that will affect the whole society too.
True,
Huh?
absolutely.
Come
And
on,
as
you don't know, you are an educated boy or educated girl, and you don't know the 1947. You don't know, and you
as I
and there I saw your video that they are all from high family.
as I also mentioned in the comment there,
Their parents taught them anything at all. This is
right?
lifestyle.
So as I mentioned in the comment there, that so many things are responsible for these things. The social system, education,
Yes, yes,
upbringing, and the environment around us.
exactly.
Like it depends on the parents also. Most of them are of my age only. Maybe 2 or 3 years difference. Either some are younger to me, some are elder to me, or some are of my age. If
Yes,
I
yes.
can know, they should also know. It depends on the upbringing as well, and very much it depends on the parents very much to teach their kids, because see, nobody is born with knowledge, but at least during the when they are toddlers, they can teach them these basic things. When we got independence, like the freedom fighters names, they are not able to name them, and
They
even they
even
don't
they
know.
even they even don't know Netaji Subhash Chandra Bose what he said. Give me blood, I will give you the freedom. They don't know it is who said that.
Exactly, sir. And
They
another
are
thing
talking
is,
about Netaji.
no.
And no. You see, Moumita, I got literally very angry that they
Hmm.
don't have remorse. They don't know they are spoiled nuts, and they are not sorry for that.
That's the main issue.
I usually do not comment, but I couldn't stop myself from making that comment that I made. Huh?
No,
Come on,
absolutely.
don't know the date of year of your independence. Huh?
Sir, we may for
This is a lifestyle, Moumita. This is a lifestyle, and that will lead to depression. At
Mhm.
one time, these young ladies and young men, they will suffer from depression. Take it from me. I have seen life. I'm
So
seeing life.
so some people are also saying that this kind of videos are sometimes also made for gaining more viewership or for publicity. Some of it are also scripted. I agree, but I don't understand the fact that okay, you may some. I should not say it, but still I'm saying you may not know Netaji because you have not seen him. But how come you don't know who is the home minister of the country? How can this be scripted? Even if it's scripted,
But so many things were there.
how can to get like just for some amount of money, even if it's scripted, how can you make a fool of yourself in front of the camera and for a video which may go viral? I don't understand this fact. That
They're
I
giggling. Momita, they were giggling. That made me more angry. So
absolutely
let us come to the point of depression. This
right,
lifestyle,
right.
it is a lifestyle disease. This lifestyle will lead to a whole generation of depression.
Mhm.
Whole generation of depression. You know that knowledge is bliss. And if you
Absolutely.
proper knowledge, you are finished. So no matter how much university degree you have, no much how much technological certificate you have, you are finished. So,
10%.
and they will be, before finishing themselves, they will commit some mistakes. And this mistake will come from their ignorance. And the ignorance will lead to depression. And depression, once depressed person, they may not kill themselves, but they will kill in other way, like they will not be successful. They will be unhappy. Unhappy people cannot do anything.
Hmm.
So there's a whole lot of looking into life. Looking into life. The another name of depression is in Bengali, we call it hatasha. Means I had some ambition that has been thwarted. So depression comes. These young people nowadays, they aspire for plenty, but they do not have anything. They are some of them, not all. There are a lot of talented people around, but those who we are thinking about or talking about, they are men and women of no substance. So if you don't have any substance, what will happen to you? It will lead to depression. What happens? Why depression happens? People don't understand. In the brain, we have a small nucleus known as hypothalamus. That is inside the brain. It is a collection of nerve cells. The role of hypothalamus is collecting informations. Whatever happening around us, it always is like computer. It is collecting information. Like corona, this, that, this problem, that problem, somebody got angry on you, so many things happening around us. It collects all the information, but it does not do anything else. It just pass all the information to the bandmaster of human orchestra, the bandmaster of human hormonal glands. This is pituitary gland. That is situated right in the middle of two eyebrow, right here. That is why meditation comes, but that is a different topic. Now, what is the role of pituitary gland? Pituitary gland, I told you, it is the bandmaster of human orchestra. This is a physiologically known. It itself do not do anything. It releases certain hormone, stimulating hormone, thyroid stimulating hormone, adrenaline stimulating. That individual hormones goes into individual endocrine glands, and it is the secretion from the endocrine glands that does all the work that we are talking about. Let us deviate one little thing. We are disturbed with so many things. Pituitary gland is releasing so many hormones. One hormone is adrenocorticotropic hormone. It goes straight to the adrenal cortex, which is situated over kidney, and it releases two hormones. One is vasopressin, another one is cortisol. What is cortisol? Cortisol is a steroid. And if steroid, you know the side effect of steroid is diabetes, high blood sugar. Now, if somebody is constantly hammered by the environmental factors and then continuously, sustainingly for over a long period, the cortisol is over-secreted, what will happen? You will be the type 2 diabetes. Because your body is producing excess cortisol that you don't need. This is why nowadays, forget about the whole world, I'm talking about in India, every 5% one is diabetes. Because of the environmental factor. We cannot ignore that. In the same way, vasopressin, it constricts the blood vessels. Every 6% one is high blood pressure. Every 4% one is high blood pressure. Every 6% has both. Why? Environmental factor. And environment is created our own. You have an environment created by you around you. I have an environment created around me. And society at large. We are one particle, individual particle moving in the ocean of particles. Everything has effect on us. In the same way, the environment that we are now, it will affect our hypothalamus, it will affect our pituitary gland, it will affect the serotonin or 5-hydroxytryptamine secretion. And the neurotransmitter, the transmission of information from one place to another place will be disturbed and causing depression. You understand the physiology of this? If your life is everything is within its limit, you are doing proper things that you need to do for your own upliftment, you will not have diabetes, you will not have high blood pressure, you will not have depression. But because we cannot manage our own life, we are getting everything physically ill, mentally ill. Mental illness has increased so many times, many times. So what we do actually, we identify the cause, try to eliminate it if possible, but there are a lot of things that we cannot eliminate. Lifestyle is something that you cannot. So we create a world, we are creating a world, we are creating an environment which is detrimental to ourselves. So as long as this will continue to happen, your hypothalamus will be overactive. Not overactive, it will collect information. It doesn't do anything else. But your pituitary gland, this is the bandmaster. Bandmaster, what bandmaster do? Doesn't do anything, it just play the things. Other hormonal glands, they will be disturbed. Every hormone that does the other things. Like if you talk about the ladies, they will have period problem, so many things. The thyroid gland, everybody's thyroid is now upside down. It was not there before. It's a lifestyle. So we are now talking about a lifestyle that is causing depression. I do not know present day how many people suffer from depression. But mainly, as we told you, that the women, they are suffering more. That is because mainly from economical deprivation. At the same time, economical upliftment also brought another type of bad lifestyle. It is a vicious cycle. Unless you control yourself, you cannot get rid of these things. That is the main thing. Treatment is, of course, there are treatment for what we do. We to uplift there are is the mood that is down, okay? So mood elevator, mood stabilizer, there are different types of medication available. Once you get out of, it takes some time. It is not a thing that you take 1 week, 2 weeks treatment and you get out of depression. It don't happen. After that, at the same time, you need counseling, and counseling means change your behavior. Change your behavior, your own behavior, lifestyle, that's all.
So I have a question for that. For example, a person is being treated, he's taking medications, but suddenly he has discontinued his medication abruptly. So what can be the outcome of it? Like, what are the effects? Are there any side effects?
That is more harmful than not taking any medication, because there will be a withdrawal effect. Because all the chemicals have withdrawal effect. As you know, alcohol has withdrawal effect. Some of these medications are slightly sedative. They have neurotransmitter work on the chemical way. So once you suddenly stop it, there will be rebound effect, and that it can make you more depressed. So you should consult your doctor. One should consult his doctor when to stop, and doctor, the psychiatrist, should be able to tell how we discontinue in a pattern, in a particular way, that, and at the same time show different way of life. That is our duty, that is counseling. Otherwise, when you are absolutely depressed, going to a psychotherapist, it makes no sense. At least that is what I was told the very first day when I went to Vienna University. Because it is the Vienna University where the psychoanalytical theory started by Sigmund Freud. So I can remember the professor told us that, look, you came to the city of Freud, but if you want to see Freud, you have to go to the museum, because there is a museum in the name of Freud, because his house and his couch and everything there. We do not follow psychoanalytical theory anymore. We do counsel, but everything has a time. When your mind is not settled, it will not take anything. If you are disturbed and go to school, will you listen to what your teacher is saying? No. The same thing when you are depressed, your mind cannot take anything. You are not listening to the doctor or counselor. So this is basically the cause of depression. It can be, as I told you, endogenous. You cannot do anything. Nothing happened, but you get depressed. That is physiological. Sometimes it runs in the family. When when a lady is pregnant, if she is depressed, it is a highly possible that the child will also be depressed at one point in time. So that is the genetical or physiological part. The other is reactive. You are reactive to certain things. And of course, I told you about the mask depression that we don't see. I can tell you in my practice, and now when I was a medical student, we were told that 60% of the patient that will come to you with chest pain, 60% of them you will find nothing. Some patients are coming with chest pain, means it can be heart or lungs. You do all tests. In my time, there was no CT scan, no MRI, nothing. But nowadays, you have everything. And 60% of the patient have no physical problem, means no diagnostically positive thing. But they are having chest pain, they are having pain here, they are having pain there. Even the osteoarthritis increased, the rheumatic arthritis, so many things. And the vascular headache, that is migraine, that everyday headache, so many things happens. This is known as functional medicine or psychosomatic medicine. People should recognize that, because going to a cardiologist and my heart is properly functioning, going to a cardiologist is not solving the problem. Not solving the problem. The cardiologist may give you certain antidepressant because he is a doctor. You will never know that, but he is treating with that. But if cardiology problem should be treated by cardiologist, is a psychological problem, should be treated by a psychiatrist. And then the psychiatrist will decide when to send to counseling. You understand? When to send to counseling. So that's it.
Sir, sorry, uncle. Another thing is, can brain scans guide in treatment of this depression? Brain scans. Can brain scans guide in the treatment for depression?
Pain can what?
Brain scans, scanning the brain, scanning the brain.
Oh, no, if you take a scan of the brain, that cannot make you depression, but scanning means some ray are passing. So when scanning, MRI is not good. Even it should be advised by the doctor and done only in case you suspect certain things. As I told you, when I became doctor 46 years ago, there was not even ultrasound. But we used to diagnose, or professors used to diagnose. Now so many techniques has come. It is useful to make quick diagnosis. But I think that it is being used without any reason. Even the patients themselves go to diagnostic clinic. diagnostic centers, and they ask, do this for me, and they do it. These indiscriminate pathology, laboratory, radiological investigation, these are not good. It should be advised by a doctor, and if necessary. So many times, if you do if the ray pass through your brain, definitely there should be some problem.
Okay. So one last question before concluding the session. For example, a person who is in depression has already come to that stage where he or she has already planned to end their life. For example, just for an example.
Yes, yes, yes.
Why would they think of taking medication, and why would they listen to others who are trying to help them? That is one of the most important questions whenever I talk about depression or mental health. This question continuously comes in my mind, that why would a person who has already decided to end their life would again try to live their life happily, and why would they
You see, if a patient are so much depressed, who has already taken a decision of ending their life, the first thing is necessary to do is admit the patient. Admit the patient, or there must be somebody around that person so that he cannot commit suicide. But who is going to decide what is his mental status? Is the psychiatrist. But once the psychiatrist understands the suicidal thought, it concrete, and suicidal plans, it is his responsibility, the doctor's responsibility, to alert the family members and give them a choice that you can admit temporarily, or somebody must be vigilant until the person comes out of that thought. Now, the person will initially refuse to take treatment, but not refuse means there is no urge, but still we different times ask to crush the tablet, mix with something, and it works. Definitely works. I have treated in the last 46 years so many depressed patients. They are totally, we call it depressive stupor. Stupor means they don't talk, they look vacantly, you cannot get anything out of them, they stop talking. So what you do? You have to give medication in some form, because till now there is no injection for depression, treating depression. And if the person take medication willingly, they recover quickly. If not, mixing with something, it takes a little longer time. But no patient with suicidal thought should be left alone at any point of time. It is very dangerous. Even the medication should not be left with them. They will take the whole amount at one time. That will be another method of suicide. I tell them, I tell my patients, I tell my family. So we have, we counsel, I counsel the family, not the patient initially, how to deal with a depressed patient. It's not easy, not easy. You have to take your time. If your wife is depressed or if your husband is depressed, you may have to take time off from work, spend time. A lot of things involved. But I think nobody should allow nowadays, where treatment is available, for somebody to go to that stage. There is another type of, you cannot say that all suicide are depression. There are some depression also commit suicide. Sometimes it is impulsive. Impulsive means somebody got angry and
Suddenly.
yeah, a lot of young ladies they got a bad result, or a young man bad result, they commit suicide. These are impulsive behavior. You cannot do anything about that. But
Like taking sudden actions.
huh?
Taking sudden actions, like out of like sheer shock or something, they are taking an action without even thinking twice. I think that leads
Do
to
you know
suicide.
how many murder take place out of anger? You just ask the criminologists. Just anger. Out of the anger's burst, they get temporarily insane. They don't know what they're doing. I have witnessed in my all practicing life quite a few murders that took place out of just anger. In Gita, let me tell you before conclude. In Gita, Arjun is asking Sri Krishna that nobody wants to commit any sin, sin, but why they do? Sri Krishna answered that three things: greed, love, anger,
Growth.
another thing, and with the calm. With the calm means the I want these, I want that, I want these, all these things. Esha kama, esha লোভ, কথাটা গীতাতেই আছে। এর জন্য তোমার বেশি দূরে যেতে হবে না। আর এই জিনিসগুলোকে যদি কন্ট্রোলে রাখা যায়, if you can keep it in under control, then you get rid of a lot of unnecessary problems. But at the end of the day, our life is, we have to get all the answer from the philosophers. And our Gita is, so that is the last thing I tell all my patients, that don't keep Gita in front of the altar. Read it, try to understand, internalize it. Once you can internalize, then you will see the life problem solved. Everything will be all right. You will be educated, you will be successful, you will have a happy life. I had a discussion in one of the meeting in Houston. And you know, Houston is all expatriate in Bengali community there. And my topic was happiness. Now, yes, happiness, but I asked first question, that tell me one thing, what people want, most of the people in their life. They said happiness. Almost, I said that is the one thing that remains elusive. People, everybody wants to be happy, but nobody can achieve it, because it is our lifestyle, it is our thought process that makes you sick mentally, that makes you sick physically. And I'm ending it with the saying that Dr. Bidhan Chandra B.C. Rai, our second Chief Minister of West Bengal, and you know, he was a world famous doctor, and he was 2 days before he died, he was asked by journalists that what message you are giving to the your patients and society at large. He said that tell them most of your sickness originate from your mind. You treat your mind, your body will be all right. And in 46 years that I am doctor now, I realized that he's so right. He's so right. There are different illnesses we cannot avoid, like genetical and accidental, or even we can avoid the infections. I'm an infection specialist. If your lifestyle is good, if your body is protected by immune power, you don't get infected easily. Like that is what the people saying now about corona. No? That protect your immune system by these, and that. If you are depressed, your immune system will be suppressed and you will be sick. That is tested. That is tested. After a bout of depression, maybe it is temporary, you are supposed to get infection because your body's immune system goes down in depression. Everything is shut down. So the immune system shut down. An immune system shut down means you can get infection. So you can prevent infection. You can prevent infection even with if you are not depressed. You understand what I'm talking about? I go to clinic every day. Patients are coming to me with fever, this, that, and so on. But I am 70 years, I still am first class. No corona came to me. That's what I'm saying. So, lifestyle, thought process, and the last thing I'll tell you, why our ancients used to say, sit down, keep your mind quiet, and keep your mind right here, because you are exercising the pituitary gland that controls your whole body, whole system.
Absolutely.
So
Okay.
keep thyroid, the pituitary gland cool, keep the hypothalamus less work, and keep yourself. I advise just stay half an hour a day, cool. Don't talk with anybody. Sit down. Meditation is nothing. Don't do anything. Just think about yourself, what you did yesterday, wrong thing, and what you are going to do today. If you have done something wrong, don't do it today. That is the advice.
Okay, sir. Thank you so much, Uncle, for this wonderful session. And everybody who are listening to us today, I just want to tell you all that it's all in the thought process, as we have discussed for all these minutes now. And it's curable. It's 100% curable. It's all in the thought process. And I guess people take it, I hope people take it in an optimistic way. And if you need any help, you can get in touch with us, any of us, and do listen to the whole video so that you can at least analyze that whether you are, if it's a mask depression also, so that you can analyze by yourself whether you are suffering from any sort of depression or not. So thank you so much for joining me, Uncle. Jai Hind.
Thank you.
Thank you so much.
Thank you very much. And I do hope that you will enlighten the people at large more and more. I am always available, no problem.
Sure. Thank you so much. Jai Hind.
Jai Hind. You said Jai Hind? Ah, Jai Hind.